The reason that I decided to do something about the knee, the pain in my knee, was that it was constant. I felt like I had been living with this pain and working with the pain for many years. And subsequently it led me to seeking out Dr. McKoy as my orthopedic. I was the first patient for this Makoplasty, and Dr. McKoy at that time was the first surgeon certified to perform the surgery in the state of South Carolina. And I felt that I was in good hands with him, so we just went for it, as they say.
I tell people I do carpentry on bones is what I do. I love working with my hands. I love building things, putting things together and solving complicated problems. And orthopedics was kind of the good mix of being able to intellectually, solve problems and then using the skills that the Lord has given me with my hands to help people out. We individualize treatment for every patient, so there's a lot of non-operative options for patients with knee pain, and probably the vast majority of people I see I don't do surgery on, because our goal is trying to get somebody better without surgery, and then surgery is only done if necessary, if everything else has failed. About 6 years ago, we did the first robotic partial knee replacement in the state of South Carolina. This past year, we were able to start doing it with something called Makoplasty. And what that is a robotic arm-assisted knee replacement. And the way that works is we get a CT scan or a CAT scan of the knee. And then from that CAT scan, we make a three-dimensional model of the knee. And what's the neat thing about this is I can take that model and I can rotate that thing 360 degrees in time and space to get a perfect placement of the implant. We can do all that preoperatively before I ever touch the patient in the operating room. We've seen the value of robotic knee replacement, which is phenomenal, and I think the patient outcomes are much better with robotics, and I think within 5 years it'll be the standard of care everywhere.
I would tell you that literally the following day, after the procedure, I was in the hospital and they came in and encouraged me to get up and walk up and down the hall. So within a day I was walking, and the following day I was going up and down stairs. So I was over the moon. Since the surgery, there's no pain. I can golf, I can swim, I can hike. I can't put into words how refreshing and liberating it is. And to this day have not had one iota of pain. It's been remarkable. I have to say, it's really been remarkable.